Welcome back, and thank you for joining us once again here at the American Society of Reproductive Medicine Conference in San Antonio. We are here in the RMA Global booth talking about various advances in the field and some of the research that's being presented here at the conference. And joining me now to talk about some of the really important things that we're learning about in these next couple of days is Dr. Richard Scott of RMANJ and RMA Global, as well as Dr. Antonio Pellicer. Did I say that right? Pellicer? Yeah?
Yeah, correct.
And you are with EV's Spain office, Madrid.
Yes.
And Madrid, Valencia, Rome.
And Rome.
All over the place.
He's the big boss.
Okay.
Yeah, exactly.
Well, welcome to the
I'm based in
here.
Rome, basically.
Awesome. So we are hearing that there is a lot of research being presented here at the conference, but much of it is being presented by your group. That there are 40 some odd research papers that are being presented here, more than anybody else. That's
42.
presented.
42. This is a total of 42. I think this, to be honest with you, I think this is a classic. We always separate groups. We always participated in this conference. We have been many times either RMA New Jersey or EV nominated to the different prize papers of the society. We got all together almost 18 annual prize papers. So this is a meeting that we appreciate a lot because we think that it's, scientifically speaking, is the most important one. Maybe the European is more attended because cities like Madrid, Paris or Rome are more interesting than Denver or San Antonio. Mm-hmm. But scientifically speaking, ASRM is the number one, and here is where we all bring the best of our work.
So this is really where we're learning about what advances being made in the field technologically or in terms of patient interaction. What are we talking about here?
Well, you know, EV does work in many different areas, and I think in this year we won 3 awards in different areas that are amazingly diverse. And so we won. We just found out today that we won an award in the immunology group, looking at some of the things that we have done with celiac disease and gluten, and knowing whether or not those things optimize our patients' care or are necessary to optimize their obstetrical outcomes. So it's a big step forward. 1,000 patient prospective study. Our group also did a very nice split cohort randomized trial looking at oxygen tension. Following up on the work of Dan Kaiser, who's one of our young attendings, one of our fellow Scott Moran, did a very nice project and has been well recognized. But we've also done work in many other areas, including in male factor. We won the Male Factor Research Award for the 3rd year in a row. And so EV has an enormous research team with very capable researchers. And rather than be dedicated to a single question or a single technology, we ask the question, what's important to our patients today? Where is our knowledge gapping the most? And we attack those problems with a really extraordinary group of people. And so this year, again, we're doing our best.
Yeah, this basically what we do is what is called translational research. So we start from the basic knowledge, but always looking at the problems, as Dr. Scott mentioned, that we have in the clinical practice and try to solve them.
What does this mean for patients? For the patients who are watching this on Facebook Live and are thinking, you know, I'm trying so hard to start my family. What does this research mean for them?
I believe it might mean 2 things, and then I would be very interested in how Dr. Pellicer sees this. But the first thing it means is that for different types of patients with specific problems, we will have more advanced protocols, better ways of providing care to them in the rheology laboratory, in the clinical laboratory, in the clinical processes, in surgery, throughout the process. So we'll have specific answers, specific questions. But it means more than that. I think it means that when you come to an ED clinic, you get access to people who focus and bring the latest information and the most current technologies to bear every day. And so you can be very reassured that we lead the way and that our program sees to it that we stay out front.
I concur. I think that we are always in the cutting edge technology, and people appreciate that, because good care to the patients, many people can offer that. That's not difficult.
The time is 5 p.m.
Things are wrapping up here, but we are going to continue on with our conversation.
But so many people can offer good care to patients, but to offer the most advanced techniques that in the end result in higher outcomes, pregnancy rates, babies, healthy babies born, etc., that makes the difference. And I tell you, patients appreciate that, and they know how to recognize that.
We've certainly covered this in our conversations in the past, but really the success rates that you are seeing are substantially higher than just the average across the board.
We get great outcomes, and it's built on the back of the research of the same nature as the type presented here this year that, again, as Dr. Pellicer mentioned, has been leading research for a very long time. And of course, our goal is to continue to lead in the future.
So I'm glad that you mentioned before about how you're looking in this research at sometimes a specific situation that is being faced by people with a specific set of issues, because when it comes to fertility, to reproductive medicine, there's no one-size-fits-all answer. Every single patient has different things, and every couple then brings two sets of things to that equation.
That's correct. We are talking about a couple, and we have to look at the problem always as a couple, because the approach could be totally different. For example, the main driver here is the age of the woman, probably, because the age of the man also influences outcomes, but not as much as the age of the woman. So we have to look at the overall problem of the couple. You are right.
What are you most excited about that has come out of this conference so far?
To see us, to see you.
I was about to say to see Dr. Pellicer and discuss research ideas, which we got to sit and do for a couple hours this morning. That's very exciting for us to do.
And it's what's great about a conference like this is you're presenting all of this research that you're doing to the broader community, to your peers, and so it's really elevating the entire field.
Absolutely.
And we come here, we present our research, we get to listen to other great investigators from around the world. And then already, as evidenced by our discussion this morning, we're talking about where to go next.
Right, exactly.
What's needed next, how we can improve our patients' outcomes. And the work on those projects will begin tonight. And so it is a continuum. It's a process that doesn't ever begin or end, it just moves forward.
I mean, people who are in the midst of it are probably only dealing with this for, a certain period of time, right? From when they realized they were having fertility issues until hopefully they have a baby. But the medicine and the science goes back a number of years, and the advances that we've seen over the course of that time have been exponential.
Absolutely, and in the field of assisted reproduction, even more. I mean, and this is good to mention, because next year will be the 40th anniversary of the first IVF baby. So the first IVF baby will be 40 years old next year. If you look what we did at the beginning 40 years ago and what we are able to do today, I mean, it's totally different. And not only that, because here in this field we are not only treating infertile couples. We preserve fertility, which is a totally different field, associated but a totally different field. We are able to diagnose diseases and cut the transmission, the hereditary, the transmission of diseases. So around in vitro fertilization and the treatment of infertility, medicine has advanced a lot. And just to mention clinical issues, because if we go to basic science, and it's even more interesting.
You had mentioned the oxygen study, and I know this is something that in one of our previous Facebook conversations, one of the doctors and I had spoken about, but it really is fascinating that you can take a look that closely at what is happening between day 3 and day 5 in utero and replicate that in the incubator and how that is making a difference. Can you just tell us a little bit? I know it's a very complicated topic, but in layperson's terms.
So the inside of young ladies, as they're becoming pregnant, the environment that the embryo lives in provides different amounts of oxygen in different stages of development.
And by day, we're talking by day.
Changes all the time, and so used to be we just cultured in normal room air, and then after some animal work and extensive human testing, we reduced that, and now we've learned it needs to be different in different times during development, and so those things that we learned from physiology have to be studied clinically and media adjusted and culture conditions adjusted to find the thing that optimizes outcomes. Our goal as clinicians is to make sure that every patient achieves their greatest probability of having a baby and hopefully has their baby. Our goal as scientists and embryologists, and Dr. Pellicer and I both have that background of being embryologists in addition to being clinicians, is to make sure that every embryo has every chance to become a baby. And so we're working to more closely match the environment inside the body in the laboratory when it's helpful, and to bypass problems when we can even do better.
All right. Well, thank you so much for spending a few minutes with us.
Thank you.
Lots of very exciting things happening at this conference, and we're going to continue to have these conversations tomorrow. We'll have another 4, I believe, Facebook Live conversations on some very specific topics, so that we hope that you will join us then back in the booth here. So that's the latest from San Antonio. Thank you so much.
Thank you.
Thank you.
Hopefully that was okay.
It was awesome.
Hopefully,
All right.
hopefully.
You're getting a lot of hits already, you two.
We may have done this once or twice.
Yeah, I know, right?